Working in an academic institution, we work with all levels of physicians. But the one thing that is always there is the Stanford nurse.
We have a lot of wow moments at Stanford. Everything we do is wow. We're top notch. And the nurses are top notch. So I would want to work in a facility that has that.
You know that excellence in nursing is a standard across all of the departments and in every field. We're already doing things that are changing patient outcomes and expanding the scope of nursing practice, and it's exciting.
We're always saying, what can we do better today? And we're looking to figure out how we can make those changes and then sustain those changes. And that's truly Magnet.
What Magnet means to me is, I feel like it embodies nursing excellence.
The culture of Magnet is a mindset. When we work together, the ideas that come to fruition are ones that work in favor for the organization, but also can be folded into practice by the nurses.
Back in 1983, there was 3 PhD nurses, and they were trying to figure out why were some institutions able to retain nurses and similar institutions right across the street were not. So they went out and they looked at 41 different organizations across the United States and found out that there were similar, what they called forces of magnetism. And from that, they developed the Magnet model, and that's defined by transformational leadership.
The application process is immense. It's 4 years of solid work and then some. This Magnet journey was very close to home, very personal. All the nurses were engaged.
It's obviously nerve-wracking when somebody comes to your institution and wants to look under every cover and find out what you do every day, but we were so excited to have them come because we knew we were great.
I think the word that comes to mind when I think of what it was like to be part of the Magnet survey team is wow. Everywhere we went, every single department blew your mind.
Seeing the response on the Magnet surveyor's face when they walked out of rooms with a smile on their face, with awe, I recall a tear, I think that was so inspiring and just uplifting.
There's a sense of pride when you hear that your organization received Magnet. And I got goosebumps whenever I heard that we got the call.
It tells the community and our employees all at Stanford that our nurses are of the highest level.
I think it makes a huge difference to be at a Magnet institution because the dedication to nursing is so clear. When you talk to nurses who come from other hospitals, they will tell you what a difference it makes.
Some of the most highly educated and experienced nurses come only to Magnet organizations. Having this designation is really essential for us to maintain a high level of nursing excellence across all of our fields.
For Stanford to achieve our 3rd Magnet designation for nursing was an amazing feat. It means that we're looking at everything across our organization. All of our 147 plus now clinics. Is the patient at the center of the model? Are we really using our professional practice to drive change continuously for improvement?
Part of the standards and scope of nursing is the expectation that you will continue with lifelong learning. Professional development, I think, sort of flies under the radar sometimes because we just are naturally doing that.
Nurses want to grow. We just don't want to stay where we are. We want to grow, we want to learn, we want to give our patients better care every day.
I love coming to work, and the patients can see that. It makes me very proud to be a Stanford nurse and to be a Magnet facility.
There's a lot of compassion here at Stanford, and I think when you bring all of these strong nursing leaders together, I think it really very clearly shows that the nurses here at Stanford are different.
Being a Magnet organization who has been through a 3rd redesignation, that puts us in the top 1% of hospitals who have Magnet designations, so it doesn't really get much better than that.
The real benefit of everything we're doing here, it's to benefit the patient. And that's why I'm here every single day working, is looking at what we can do to make healthcare better, what we can do to make people's lives better.